Hello dear students, today I'm going to talk about geriatrics. I'm a professor at the NUMS Department of Family Medicine. My name is Ayuzan. Okay, today I'm going to talk about the aging. What does the aging mean? That's a life change that occurs when the people get older. So aging is a main topic, key important thing in gerontology. So what does a gerontology mean? That's a science which studies about aging process. So on this aging process, it's included biological age, psychological age, social age, legal age, and functional age. So who is old? Biologically, psychologically, aging change usually occur gradually over the years, and as a result, there is no single age at which people in general can be said to be old. But most commonly, people say that age 60 and above, it's called old age. But as a gerontology, the young old is above 75, middle old is referred to above 75, and the scenarios like oldest age is referred to above 85 years old. So what are the cognitive abilities in later life happening? For example, there's processing speed reduced. Also, working memory is so reduced in older age. For example, like including consciously recalling a telephone number, they need for a long time to write it on. So also sensory and perceptual changes happen in that age. So that's why visual and auditory problems happen in older adults. So right now I would like to explain about the neurological changes in older age. For example, neuroimaging studies, for example, MRIs, have been detected that in older age there are serious changes have been happened. For example, the affected area is cortex, prefrontal lobes, hippocampus. So also the general atrophy have been generally spread in white matter. So the spirit areas have been localized temporoparietal associative areas. So that's why the global pallidus and pallidus and sensory cortices and pons have been changed in that change. Okay, what about general aging trends? So how about the attention? Attention span is lower, declined. Complex attention is mildly declined. How about the language? Communication, so might be a little bit declined. And syntax, word knowledge is a little bit declining. And naming is mildly declining. Comprehension is stable to mild declining. Discourse is variable, is depending on the person. So how about the memory? There's a short memory. It's a stable to mild decline. How about working? It's a mild to moderate decline. And secondary memory is moderately declining from the age. So how about the memory as remoting is variable, perspective is variable, visual spatial is design copying is variable, topographic orientation is declining. So memory speed is declining by the age. So factors that influence cognitive aging, that's the genetic factors. About 50% of cognitive variability in old age can be traced to genetic factors. Physical activity is main of the factors. With older age, we need to do aerobic fitness as can as we much be. In that, we could prevent from aging. Also, personality and mood, depression, and also anxiety, and also mood disorders could be addressed, could be influenced in cognitive aging. Also, social and cultural factors, cognitive training, and sex differences might be influenced in cognitive aging because the female could be more lower influenced by the cognitive aging. And racial ethnic differences might be influenced by the cognitive aging. So personality and emotional changes. It's what is the adult personality? It's consists of three developmental forces. For example, social clock and grand adaptive strategy and genetic factors. So for the person, depression is effects for the health outcomes. And neuroticism is inversely associated with self-perception of good health, and extraversion is positively associated. So emotions, coping, and well-being is the crucial part of being personality of the person. For example, emotion, always an emotionally rich and complex phase of life, and silence of emotion increase in later years, have better control over emotions than do younger adults. So what is the personality and emotional changes consist of? That's a coping, emotion-focused coping, and well-being. That's the main property of the personality emotion of the older age. So what do we do? Educate. What do we help in order to increase social and increase personality and psychology? We need to educate on, we need to work on, and we need to balance financial status. For example, we need to educate on about life and health. For example, in work, lack of work, loss of income, continuous work help physically as well as financially. So financial status usually comes from retirement, loss of income. Also some of the psychological changes happen from widowhood, losing someone, and retirement in extended families. That's one of the main problems in older age. So by the Byron and Zarat determination, what does the aging mean? Aging is biological aging. Senescing is the process of change in the organism which over time lowers and probability of survival and reduces physiological capacity for self-regulation, repair, and adaptation to environmental demands. Wow, there's a good determination. And so we would need to learn about primary aging, secondary aging, and in order to know about the primary aging, we need to know about the relative constant maximum lifespan observed in almost all animal species studied. So what is the theories aging? So there's a lot of aging theories. So one of them is physiological genomic hypothesis. One of them is organ-based theory, and that's a loss of organ function have been driving to aging process. But physiological theories, for example, toxic levels, for example, chill waste products accumulating. That's why the aging process happens. So from some of the genomic hypotheses, that's we call Hayflick phenomenon. That's a most described theory. According to this theory, there's happened telomeric shortening. That's we call the clock in the cell. This clock in the cell is usually regulating cell death also we call apoptosis, cell mutation, and cell mutation, also cell programmed cell death. So that's, if the telomere shortening, it would be worsening and the aging process would be happening. And also there's antioxidant theory, that's also called wear and tear. So primary aging, that's the structural and functional changes happened in the body. For example, the aging pigment accumulates. Also heart valves thickens, gets thinner, number of pacemaker cells decreases. Also ventricle is increased in size. Also heart may feel more slowly, bradycardia is more often. So those changes could be caused from illness, infections, emotional stress, injuries, and extreme physical exertions. So what happened in the vessels? The vessels would be thickening, stiffening in the media. And that's why all the AMI and also ischemia, all changes happen in that of change. What happened in the veins? Age-related changes are minimal and do not impede for normal functioning. So what about the blood pressure? In geriatric patients, there is a usually common fall in diastolic blood pressure. It's very common increase of systolic blood pressure. It's because of the hypoxia. Also, baroreceptors become less sensitive with aging. So that's why in older age there is a most common finding is that orthostatic hypertension is very occurring. So also observed hematologic changes. What is that? That's a number of red cells are reduced, but not significantly. But also lymphocytes decrease. And other cell counts parameters in the peripheral blood are not significantly different from in young adult life, but however, the cellularity of the bone marrow decreased moderately. For example, 30% cellularity on Geriatrics biopsy, which would be very low for a young adult, is not unusual in an older person. So how about the immune system? Immune system declines with age. Non-specific defense becomes less effective. The ability of body to make up antibodies diminishes. Autoimmune disorders increase in old age. Also, thymus gland is atrophied throughout the life. The peripheral T cells proliferate much less in old age. So, result, common infections are often more severe with slower recovery and decreased chance of developing adequate immunity. What is the respiratory system? Number of cilia and their level activity is reduced. Glandular cells in large areas are reduced. Decreased number of nerve endings in larynx. The cough reflex is blunted. Decreased levels of secretory IgA in nose and lungs. The number of alveoli do not change significantly. So decreased elasticity of the lungs may be due to from collagen cross-linking. So what is observed in pulmonary respiratory system? So there is combined less functional alveoli with slightly thickening capillaries, decreased surface area available for oxygen to carbon dioxide. So the respiratory muscle lost strength and endurance, increased stiffness in chest wall decreased, pulmonary vasculature becomes less elastic, increased elasticity blood flow in lungs, increased pulmonary arterial pressure. What happened in the kidney? So the kidney size decreases by 20 to 30% by age 90. There is a declined number of renal tubular cells, increased tubular diverticular, thickening of tubular walls, decreased ability to concentrate urine, clear drugs from the body. What happened in the blood? The muscles, ureters, and urethral bladder lost tone elasticity, declining bladder capacity. This caused more frequent urination. What happened in the muscular system? Sarcopenia is the most common illness in old age. That's why the main cause of loss of height in old age. So what happened in the GI tract? GI tract, that's the most common age-dependent changes happen in that age. For example, taste buds number have been declined. Acid production is declining. Number of gastric cells declining. Pancreatic enzymes is decreasing. Diminished pancreatic enzymes and also size of pancreas is declining with age. So what happened in the nervous system? So loss in chiefly gray matter, not white matter. Slowed neurotransmission, loss of brain weight, loss of dendritic area. So what happened in the eyes? There's a dry eyes, change in sleep cycle, sense of smell, markedly decreases. So what happened in neurobiology of aging? Cortex is middle frontal gyrus, hippocampus, cerebellum, brainstem is usually changed in that age. Also, acetylcholine, serotonin, noradrenaline, dopamine is a little bit from mild to moderate changes happen in that age. So observed hair changes in men. Might mostly be in a baldness than women. So what about toenail? These become more thicker, more difficult to cut off, grow more slowly. They have a yellowish color. What is the on skin? Epidermal cells become thinner, making the skin look noticeably thinner. Change in the epidermis allows more fluid to escape the skin. So the ridges of the epidermal junction flattening out. So this process also decreases the amount of nutrient developed by epidermis to epidermis by decreasing surface area in contact with the dermis. So what is observed in the skin? Dermal layer thins, less collagen is produced. The elastin fibers that provide elasticity wear out. So what happened in the endocrine system? The endocrine system is mostly affecting in age. The most glands get atrophied, decrease secretion, and most of them caused glucose intolerance, reproductive function alteration, and calcium metabolism changes. So that's why that's the cause of adrenal function and thyroid function have been altered. So what is the age-related change in the reproductive system? Thinning, graying of pubic hair, loss of fat in external genitalia, ovaries, uterus decreases in size and weight, thin skin and less elastic, loss of glandular tissue gives breasts to sagging appearance, and also other physical changes happen. To stay unhealthy with physical activities, and need to examine, and we need to give a more crucial best follow-up for the older population. That's why we could prevent from those all illness. And on this lecture, I would like to end by this word: healthy children will not fear life if their elders have integrity enough not to fear death. So this is the main phenomenon, main key character, what I would like to say on this lecture. And thank you for your attention.